Hi, I'm Martha Lawley, representative for House District 27 in the Wyoming State Legislature. Today, I want to walk you through one of the most significant opportunities Wyoming has ever had to strengthen rural and frontier healthcare. It's called the Rural Healthcare Transformation Program. This initiative is part of a broader federal legislation that is often referred to as the One Big Beautiful Bill. Every state had a chance to apply, outlining how they would use federal dollars to improve healthcare access for rural communities. Wyoming's application was accepted, and Wyoming has been awarded $205 million per year for the next 5 years. Think about that. That totals just over $1 billion dedicated specifically to rural healthcare transformation. For a state like ours, the most rural in the nation, with many communities that qualify not only as rural but frontier, which basically means extremely rural or remote. This represents a once-in-a-generation opportunity to address long-standing challenges in healthcare access, staffing, and service delivery. There are some restrictions, however. For example, the funds cannot be used to construct a new facility, but they can be used to transform how we deliver the care, strengthen the services, and support the systems we already rely on. The Rural Healthcare Transformation Fund will increase the upcoming biennium budget by $410 million. All these dollars are federal. No state revenue is involved. However, because we receive and distribute these funds, they must be included in our state budget for transparency and accountability. Here's how some of the major components break down. Ambulance and hospital programs, $98.1 million in the governor's proposed biennium budget. These support essential services and emergency services that are a lifeline for our rural communities. Indian healthcare programs, $48 million in the governor's proposed budget, strengthening healthcare access for tribal communities and honoring our federal obligations. The remainder of the $410 million is for basic rural transformation initiatives. These long-term initiatives will take shape over the next several years and throughout the upcoming budget process, focusing on modernizing how healthcare is delivered in rural Wyoming. And remember, these figures only represent part of the total picture. Wyoming's Department of Health also administers numerous other federal programs. All those federal dollars also flow through our state budget, even though they do not come from state revenues. As we enter the upcoming budget session, it's important for all of us to understand how the federal dollars move through our budget, why they appear as spending even though no state money is being used, and how these investments position Wyoming to improve healthcare access for years to come. But this program is not simply an accounting line in a budget. It's an opportunity to address real-world challenges families, seniors, first responders, and healthcare providers face all across our state. Over the next 5 years, Wyoming will have more than $1 billion federal dollars dedicated to strengthening rural and frontier healthcare. It's a tremendous opportunity and something I'm going to be following closely throughout the budget session and beyond. If you care about healthcare access in rural Wyoming, this is an issue that I hope you'll continue watching. Thanks for joining me. Please message me with any thoughts or questions you have on this important topic. Have a great day.